This is Mayor Gavin Buckley on the Maryland Crabs saying this is the best solution to a hangover, listening to these guys talk. I feel better already.
Live from a grungy kitchen table located in Annapolis, Maryland's scenic and historic capital, it's the Maryland Crabs Podcast. With each episode, your hosts, Tim Hamilton, John Frenay, and the occasional guest will dive in and pick apart the stuff that really matters most to you. We're too lazy to actually solve any of these problems, but we can definitely stir the pot. From schools, politics, parking in the fire lane, to those horrible people who drive BMWs. And here with this week's episode, live from the kitchen table, Tim Hamilton and John Frenay.
Well, hello there. This is John Frenay with the Maryland Crabs, and I am flying solo again this week, as Tim is, I think he's in Altoona of all places, so someplace I'd rather not be, so hey, it's up to me. Hey, you know what? I get What's Up magazine. I'm sure most of you do that, and I couldn't help but notice that there are tons and tons of ads and articles and everything else for plastic surgery, weight loss, teeth whitening, and stuff like that, and I thought, hey, there might be something to this. I'm not quite sure what it is, but I decided to figure it out. I went to Chesapeake Plastic Surgery and I talked to Dr. Barlow and also Mary Ann Treger. Now, Dr. Barlow is a board-certified plastic surgeon. He's been practicing for decades, and he is consistently rated as one of the top surgeons by Washingtonian magazine. And that's like for decades that he's been rated as a top surgeon. Now, Mary Ann Treger also joined us, and she has written extensively on cosmetic surgery and injectables and all of that type of things. And she is actually a patient, and she's not a patient of Dr. Barlow, but she has had procedures done. And we went over to his offices on Bestgate Road, just sort of to see what was up, see what this whole plastic surgery craze, as I see it, is all about. So hang tight. We're going to get right into it with Dr. Barlow from Chesapeake Plastic Surgery and Mary Ann Treger.
Imagine your child saying,
"Guess what I learned in school today?"
At St. Andrews, it happens every day. We asked Emma and Lawson why.
We grow winter greens in our garden to make smoothies. Second graders are the chicken checkers, and our 8th graders take care of our goats.
Our classes are the perfect size, which means we get to know each other well. And our teachers know us. They're great. Visit St. Andrews Day School's open house on Friday, January 18th from 9 to 11 a.m.
Or call 410-266-0952 for a tour.
We're here at Chesapeake Plastic Surgery on Bestgate Road, and one thing that I've noticed over the years is that some of the local magazines have come up with a lot of, we'll say, elective beauty things. You've got teeth whitening and plastic surgery and everything else. I thought it'd be kind of interesting to talk with a plastic surgeon and figure out, what's what, and learn a little bit about the concept. And joining us today, we have Dr. Barlow, who is a doctor of plastic surgery. That's not really the full title. And Mary Ann Treger, who is a local writer who has written pretty much extensively on different elective procedures for primarily women that are looking into this thing. And we just sort of wanted to, I don't say get to the bottom of it, but just to learn a little bit more, because it's certainly something new and different to me, because I'm probably, the males are probably the minority of your clients or your patients, I would imagine.
Well, that's true. But interestingly, it's probably one of the fastest growing segments of our industry as well.
I guess the biggest question I've got is, if I'm looking for some kind of plastic surgery, whether it be a scar reconstruction, I know my daughter's had a scar reconstruction, which is not a big thing or a large thing. What is the most important thing that somebody has to do to make sure that they're getting a legitimate surgeon that can do the job, as opposed to, I don't know whether they use the term quack anymore, but somebody that's not qualified? Where's the qualifications?
Well, again, I think due diligence is always applicable in the situation. Everyone should kind of do their homework, and now with the internet and so much is available about it, most doctors and physicians online, but also talk to several different physicians and doctors. But if it's related to plastic surgery and things of that nature, I would certainly emphasize speaking to a board-certified plastic surgeon, just like I would emphasize going to a board-certified internist. These are qualifications that are essential to be able to get the most qualified person.
Well, you were obviously a board-certified surgeon, yep. And you have offices in Northern Virginia as well as here.
That's right.
And you've been named as one of the top surgeons by Washingtonian magazine for several years.
Since 92.
Since 92? Okay, so you've been named as a top plastic surgeon longer than some of my kids have been alive. That's impressive. I don't know whether that's impressive or depressing, one of the two. Well, actually, that's kind of interesting because you've been around for so long doing this. How has the industry, the business, the practice changed from when you first started? I don't ever recall in 92 seeing just a lot of advertising. I mean, we see this on television and radio and everything else, that medical technology is...
Yeah, over the last 25, 30 years, that certainly has changed quite a bit. The number of plastic surgeons who are emphasizing cosmetic side of their practice. Most plastic surgeons, and myself included, we do both reconstructive and elective cosmetic procedures. In my practice, the most common elective procedure is something related to breast reconstruction after mastectomies and other procedures of the breast. A number of plastic surgeons now just emphasize and do only cosmetic type procedures. And that is a total opposite of what it was when I began practicing before. There was only one or two plastic surgeons in probably the greater Washington, Baltimore area that specialized just in cosmetic surgery. And that certainly has changed considerably since then.
Have you seen a growth of, and I'm sort of curious, I looked at your website and everything else before we came over, but you've got a lot of procedures that are available for men. Have you seen a real growth in men seeking out cosmetic surgery? I mean, reconstructive surgery is reconstructive surgery. Yeah. And I'm presuming that could be from an accident.
Could be.
Or, as you mentioned, breast cancer, both obviously for men or women, and
and skin cancers. There's, a number of related procedures for men that, unfortunately come about. But in the cosmetic area, it has increased significantly. Men tend to age a little more gracefully as far as the public perception than women, but a lot of men would like to do a little this or that to look a little bit better, maybe a little younger, and, as long as it's something that's safe and reasonable.
Ask Mary Ann, who has written extensively about I hate to call it an industry, but the area of medicine, this specific area of medicine. What has been your impression? What have you seen over the years as far as changes?
Well, what I've seen is the increase in the use of injectables, not only by myself, but many of my friends. And I think Dr. Barlow would probably speak to the fact that has been a big growth generally with plastic surgeons, where the business is increasing in injectables and less surgery and more injectables.
Okay, and when you say injectables, we're talking about Botox for the eyes and the lips, and then collagen that I know some of the movie stars have to put fuller lips or something. Is that pretty much?
We're talking about fillers, because what happens as you age is not so much that your skin is getting loose, it's that you're losing volume. So the fillers give you an increase in volume, which makes you look more youthful. And that's the job of the filler without having to undergo surgery.
Yeah, when we look at the field of plastic surgery, as Mary Ann had mentioned, fillers represents an area of what we call the non-surgical options. We certainly have the surgical options when indicated, but the non-surgical procedures that we do in plastic surgery has just increased exponentially, and fillers is a big part of that. As I was mentioning earlier, collagen was used initially but didn't last very long. The fillers that are available now last 1.5 to 2 years, and in some patients maybe even a little longer. So that makes them a very good option for many people.
Yeah, I'd love to ask Dr. Barlow about this new filler called Versa. It promises a longer life, and fillers are expensive, so having it work for a longer period of time is important. Have you used it, and what do you think of it?
Well, I haven't used it, although one of our estheticians here, injectors, has tried it. It's relatively new. It's a hyaluronic acid filler, which is a normal natural body amino acid protein. And it's no different than the other fillers that we use on an everyday basis. Its claim to fame, apart from just being new onto the market, I think it's named Versa, yeah. They manufacture claims that it produces less swelling on injection and may last a little longer. I think the may last a little longer is still yet to be seen because it is relatively new on the market. But anything that extends the life of the fillers, I think, is a positive if it's combined with a good price range. Right now, from my understanding, Versa claims to last up to 6 months. And until we have more experience with it, I couldn't personally validate that. But if correct, it has some advantages.
Well, you talked about the pricing there, and I'm going to presume that for the most part, a reconstructive surgery is probably something that would be covered under an insurance policy. And, elective cosmetic surgery is probably not. Do they offer financing things, or is this just a cash up front? I know I had LASIK done on my eyes, and it was just, I had to write the check to Dr. Scott, and it was, it was just probably the best money I ever spent. But is it similar here?
It's very similar. Yes, it is. And probably for a good reason. I mean, it's such a difficult thing for many patients to have to work through their insurance companies to get reimbursements for these procedures. But yes, it is. And there are means and financing available for most of the procedures. But again, I don't recommend anyone going into debt for an elective cosmetic procedure, but it is something, though, that is not reimbursable by insurance companies.
Are most of the procedures now done inpatient or outpatient?
Oh, I would say they're all outpatient, unless very extensive. Most everything.
So, if there's a disconfigured something through an accident or something like that, that would obviously it's something a different ball of wax. But do you do most of the procedures right here in your offices?
No, but I use a number of the outpatient surgery centers. Locally on Ridgely is the Arundel Ambulatory Surgery Center. We use that. Again, outpatient surgery has responded to the popularity of a lot of these procedures that can easily be done as an outpatient. So you don't always have to be in a hospital. That being said, these centers are always staffed for the most part by the same anesthesiologist and so forth who work at the hospital as well. Now, we can do in the office setting anything that's under local anesthetic. Mm-hmm. The patient's awake, we numb the area, and we can do many of our many of our minor procedures in that form. But anything that requires sedation or being asleep, then we choose to do it in one of certified facility. And again, that reflects back on being board certified in plastic surgery, because to be certified as a member of the American Board of Plastic Surgery, I agree to always do procedures under anesthesia in a facility that is certified and with anesthesia oversight. So the emphasis is on patient safety. I mean, we often kid that you could do open heart surgery under local anesthetic if it were necessary, but it's not the right way to do it. And patient safety has to always be the first object of anything we do.
You've mentioned again the certified, and what are the letters that we need to look for when you say a board certified? I mean, you said the American School of Plastic Surgeons?
American Board of Plastic Surgeons. Under the auspices of the American Board of Medical Specialties, which is the oversight in the nation, every different area of surgery, general surgery, plastic surgery, ENT surgery, cardiac surgery, all these areas have their own boards. So in our case, it's the American Board of Plastic Surgery, but they have to meet certain strict requirements that are not found in any other type of certifications. As Mary Ann maybe mentioned earlier, you can go to some tutorial in clinics and learn how to do a particular procedure as a non-plastic surgeon and feel, like you understand it, and advertise yourself even as a plastic surgeon, but you certainly don't have the training and the background sufficient to do those procedures.
Stupid question. Is that legal to advertise?
Well,
I'm going to say that it's certainly unethical, but it's...
It is legal. There's certainly a lot of emphasis on a national level to try to tighten up state laws to govern this type of activities. And they've made great strides. In the state of Maryland, for example, the medical board specialties certainly watch very carefully not only what you're advertising, but what your credentials are. And generally speaking, in order to get privileges at a hospital, you have to be certified to be able to do the procedures that you say you can do. So when you go to a hospital, you can rest assured that those people who are doing those procedures are certified. But once you get into the office setting or into an outpatient surgery center, there's not quite the same oversight. And so that's why we often see a different type of physicians doing different type of cosmetic procedures.
What type of additional, I mean, obviously you've gone through medical school and you're as a medical doctor, but beyond that, to specialize into plastic surgery, what additional training at the most basic level? And certainly after this many years, 26?
Yeah, it's 27. Yeah. Well, although the requirements for plastic surgery has changed a little bit most recently, at the core of it is obviously medical school, and then you go into your surgical specialties. All plastic surgeons have gone through general surgery. Some have gotten board certified in general surgery. Others have gotten to the last year of general surgery. But every plastic surgeon has to have a minimum of 3 years of general surgery. In my case, I had the 5 years, and then you go on and you do your 2 or 3 years of plastic surgery.
Okay.
So I've done general surgery, and I've done 3 years of plastic surgery, and I've also done 2 fellowships beyond that, one in hand and microsurgery and the other in pediatrics. So not that always is crucial, but I mean, it is an extensive process. In fact, plastic surgeons are the only, and cardiac surgeons are the only ones that have this extensive time of training.
Why do they call it plastic surgery? I don't think you use plastic too much anymore.
It is an interesting derivative. It comes from the German plastiki, which means to mold or shape. And the idea of plastic surgery, of course, it started in the reconstructive. So when soldiers were deformed or had defects that we were trying to either treat or reconstruct, it was sort of like using a plastic or, to reshape or mold these defects. And that's where it has just sort of stayed with us.
So that's probably where the word plastic came from, too, as opposed to the practice coming
exactly.
from it. Interesting. Mary Ann, what other types of injectables and surgeries and stuff like that have you been writing about that I may not know about? I mean, the obvious ones we've talked about, the Botox and facelifts and breast augmentation and reduction. Certainly liposuction is in there as well for probably both men and women.
Well, I'm very intrigued by these mini facelifts that a number of my friends have had, where you go to the doctor's office and it's right in the office and it's on local anesthesia, and the promise is have a mini facelift and go out to lunch afterwards with basically no downtime. I'd love to know what your thoughts are about that, and do they achieve good results in the long run?
I think in this a mini facelift, I think by the fact that we're calling it a mini facelift is restrictive in nature. I mean, it is not intended to be a full facelift and may not be used to address the same changes that someone who should have a full facelift. If you have just minor early aging changes, then maybe a limited type of a facelift procedure would be beneficial. On the other hand, I'm not very encouraged with the long-term results of many of these techniques because they deal just with the skin and not the underlying structures, which are kind of leading the way for where the skin's going. And I'm certainly not very impressed with the long-term results with many of these type of procedures that involve just suture lifts or thread lifts or anything of that nature, because they just haven't lasted very long.
Mm-hmm. The other question I had is on all the different fillers that are now being advertised directly to the consumer, Restylane, Juvederm. How does a woman know which one is right for her when she goes to the doctor or the a nurse to have some fillers, how does she know when they're recommending the right one for her problem?
The Restylane and Juvederms, they're two different companies, but it's the same product. Manufactured maybe a little differently, but it's hyaluronic acid. And, of course, this new company that's coming on the market with Versa, which is Revanus, I guess, or Revanus company. Again, the product is really the same. So I think in many ways, most plastic surgeons either find one that they're more comfortable with working with, or they offer several. And I wouldn't say either one has a particular advantage over the other. But within each of these companies, their hyaluronic product comes in several different forms. I like to use the analogy of crude oil being refined to diesel, unleaded, regular gas, and jet fuel. These are all different phases of the refinement. So you can take the same filler of a company, let's say, again, a hyaluronic acid, and refine it so that the particles are a little bigger. And you can refine it to where the particles are very small. The bigger particles work tremendously well deeper in the tissues for large volume, whereas the fine, small particles are best used in closer to the surface of the skin, maybe these little fine little lines. And so by refining it, if you will, that term makes sense, the same manufacturer of hyaluronic acid and their different products work in different areas, different depths of the face. And I think, again, all the two main companies that we use in our field, both are excellent companies and their products are wonderful. So I don't think it's so much a matter of which of the products or the companies that your plastic surgeon is using. It's just of those products, what's the goal of what you're trying to do? What kind of volume are you trying to replace?
One thing you just mentioned, you said have a mini facelift and then go out and have lunch. Was that just figurative, or is that like...
I know someone who did that. That's why I asked the question. I actually have a friend who did that. She had a mini facelift in a doctor's office, chatted with the nurse about movies and what they were going to do for the holidays, and then went to lunch with her husband afterwards. So that was a very real question.
I mean, I do remember when my mom had facelifts. I mean, she was down for the count for... And this is back in the 80s, I guess it is. So she was, down for the count and the bruising and the...
Oh, that's very different.
Never see, don't let me see any friends. And
Well, again, assuming we're talking about the same procedures, a full facelift you wouldn't do under local anesthetic.
Right.
You might have some sedation involved with it, IV or something related. A lunch hour facelift is probably a fairly minimally invasive type of a procedure. And if what they're trying to correct is correctly treatable that way, then I don't have any problem with it. But I don't know of any surgeon that would advocate doing a full facelift under
and then
local
go to lunch.
No, that's totally different.
Right.
I had a facelift about 12 years ago, and there was no way I would be able to go out to lunch afterwards. You have drainage tubes and bandages, but the mini procedure is just a small incision around the ear, and it's just pulling the skin. It doesn't go into the underlying muscles.
And, of course, there was a large chain of surgery centers that recently went out of business that was their main focus was facelifts under local anesthetic. And not because of that procedure did they go out of business. It was just the model of the business, but everybody kind of recognized that.
Well, we've all heard horror stories about facelifts gone wrong or too much filler, and we've seen horrible pictures of movie stars that have been overfilled. What do you say to a woman who perhaps has never done anything before and yet feels like she's aging, wants to do something, but she's a little fearful? What advice would you give her?
Well, again, it starts with visiting with someone you can trust, and to give you the advice that works best for that particular individual. And that would be a board certified plastic surgeon in most cases. But I think when I see a patient for the first time and we're talking over the things that they would like to see improved, we tend to take a little bit more conservative approach. And let's start with some of the things that are important and easiest to address. and get those corrected. And for most women, good skin care is essential. They're probably already doing a lot of skin care on their own with over-the-counter products, but if you can direct those a little bit more correctly, there's some wonderful changes just to the texture of the skin that you can do to begin with. But if some of the aging changes or undesirable changes are starting to show up, then we should have a number of options for them to choose from. And again, trusting your surgeon is certainly implied here. Maybe fillers will take care of it. Maybe it's just a Botox for a younger patient. Or maybe it's something like a laser treatment for the skin and things of that nature. So where do you start? Well, it really just depends on what the problem is that we're trying to address. But for a young patient, which we're certainly seeing very frequently now in late 20s, 30s, and 40s, the quality of the skin is essential. That's why I mentioned good skin care. If you address that issue early on, I think your rewards are tremendous as you get a little bit older and as the effects of sun damage starts to be seen. And, Botox, for the young patient who doesn't really have wrinkles, but by using Botox, maybe even, a couple of times a year, essentially they're pushing back the development of facial wrinkles maybe 10 or 15 years. And I wouldn't be a bit surprised, and maybe not necessarily in my lifetime, but not too far in the future, when we won't hardly see wrinkles on the face anymore because of things like Botox. Botox is a neuromodulator, a toxin, which puts the muscle to sleep. So if the muscle's not moving the skin, then the little wrinkles on the skin aren't going to develop. Now, obviously, you can't put all the muscles to sleep like that, but for the most part, those that tend to show age, forehead creases, the scowling, creases between our eyebrows, and of course crow's feet, for the most part can be easily corrected with Botox. So a young woman, if she's going to start doing that, even twice a year, she's pushing back the day when those would normally form. For those of us who have already proudly created our wrinkles, we can soften them tremendously, but we have to be pretty religious with the Botox. When it starts to wear off, before that tissue memory starts to come back, when the muscles start to work again, you need to retreat it. And if you can give your skin enough time and not create these wrinkles, they'll soften and in many cases just go right away.
You touched on lasers, and that is an area I find very confusing. There are so many new machines on the market, or intense pulse light, for instance, and Thermage has been around a while, and now Halo. That's another area of confusion. Do they all do different things, or are they basically the same, and just depends on which machine you have?
The idea of lasers and pulse light therapies and stuff, there's so many different manufacturers that are all trying to produce what they think is a better machine. And of the 3 or 4 main manufacturers, their machines are all very, very good. But they all depend upon a light source. And the difference is just the light that they're trying to use. What might be the better for one treatment, it really just depends on what the light source is that they're using. The Halo you mentioned, it combines 2 different wavelengths, so it's able to treat or target areas, 2 different type of areas. Broadband light or intense pulse light, they're a little bit more generalized, and they treat a lot of different areas, but they can treat many things very, very good. The lasers, although there are many of them, each of them is based on a particular source of light. And based on that light, the target tissue is going to change. A CO2 laser, which is certainly the standard in the industry, but not used quite as much anymore because it's been replaced by Fraxel CO2, it addresses water. And so it works very well for the surface of the skin. Whereas the Halo and the wavelengths that it uses, one of those wavelengths, the 2900, goes right to the deeper dermis where the collagen matrix is. And so that process is, when stimulated, creates sort of an inflammation, and that inflammation recruits the building up of new collagen. So, you might have a vascular malformation. So you would choose a laser that is tunable to hemoglobin or the iron component. So the vascular lasers can treat the reds and purples. So if you've got a varicose vein, do you want to treat that? Then you're going to choose a laser that the light source targets that particular color or type of tissue. So the lasers are wonderful. There's many of them. Again, it kind of comes down to trust your provider if he's choosing the right modality for what you're trying to treat.
Within the practice of plastic surgery, obviously there's people that specialize in certain things. I mean, there's somebody might be known for the breast augmentation or the breast reduction, and others are facial peels and whatnot. Do you have a specialty that you find it or you...
Well, I think it's one of evolution. I think all plastic surgeons can do the majority of our procedures: breast augmentation, breast work, breast reductions, breast lifts. All plastic surgeons are expert in those procedures. But sometimes when you get into the things like a facelift or facial rejuvenation, a certain degree of maturity adds to that expertise. So like in my practice, I probably, the majority of the procedures that I do relate to facial rejuvenation. And that involves, facelifts or eyelid surgery, volume replacement, fat grafting, brow lifts. It's just a bigger piece of my practice. I still do breast work and other things as well.
Did you always want to go into plastic surgery when you were in med school, or were you...
No, it was a sort of a latecomer for me. I wanted to be a heart surgeon. In fact, I was just getting ready to start my heart training when a sort of a family tragedy occurred, and I had to step away from training for a year. And when I came back, I questioned whether or not that was going to be the right field for me. And so I started looking at other things, and plastic surgery gave me the satisfaction of doing very fine, meticulous work, very much like heart surgery. There involves microsurgery as well, and hand surgery. There's so many different areas. And the big attraction for me for plastic surgery was the variety. I mean, plastic surgeons take care of hand surgeons. We're pediatric congenital surgeons. We correct the congenital deformities. We do all this reconstruction. There's just cosmetic. There's so many different areas in plastic surgery that one can essentially specialize.
Well, as you mentioned that, it's something I never really thought of, but it's, it does really sort of reach across all sorts of different disciplines.
It does. And although I certainly, if someone came to me now with a cleft lip or cleft palate, I would refer them to one of my colleagues who do them regularly. But certainly I was well trained in the procedures, and I really enjoy going to other countries. They're less fortunate for having physicians and we go out into these small areas and are able to do these surgeries on these little kids and change their lives. That's not to say that I don't get a great deal of satisfaction helping a woman who's undergone a mastectomy for breast cancer restore her breast and to a very lovely, very similar breast to her opposite normal breast. Gives her back her femininity and her wellness, and there's a great deal of reward and satisfaction and joy in that type of a procedure.
Certainly, there's also got to be a lot of, I'll say personal satisfaction in that it's a happy thing. I mean, you're helping somebody feel better about themselves, whether it be visually or physically or whatnot, and it's just something that they, come out with a good thing. I mean, this is...
and that's really the idea of even cosmetic surgery. I mean, someone who looks good but would like to look a little bit better, I mean, that could be very satisfying to them.
Is there ever going to be a pill we can take to lose weight or to get those six-pack abs or...
Not that I'm aware of.
not in our lifetime.
Not that I'm aware of. Probably one of the biggest areas of, I think, revolution coming down is with fat grafting. We've learned a lot with fat grafting. This is a procedure where we take fat from one area where, most of us have a little extra, and we treat it, we separate it and refine it down to its sort of either the stem cell component or its finest components, and then we inject it into the body where we need it. Facial rejuvenation, it works really well as a long-term permanent filler. Rather than using a filler, we use fat. But for breast reconstruction, we can add some fat into a reconstructed breast to give it a much more natural look.
So for fat grafting, you'd mentioned that's taking fat out of a problem area, whatever that may be, distilling it, for lack of a better word, down to, I guess, the fat cells as opposed to all the other gross stuff that's in it, and then re-injecting or reinstalling it into an area that needs the help, and in the hopes that would grow again to fill out?
Yeah, I mean, it's dependent upon going in there and finding and establishing a new blood supply, but technique is certainly a big part of fat grafting, but if done correctly, those fat cells are exposed to a new blood supply, and they then continue living just like they were minutes earlier.
That grafting would be typically from the same patient?
Yes,
right?
It has to be from the same patient.
Okay, so, wow. Now, how new is that?
It's been around about 15 years, maybe even a little bit longer, but certainly in the last 5 to 10 years, it's been refined. And like I said, even now it's being refined even further. We're getting down to where we're starting to do nano fat grafting, where we take the thinnest part of that material, almost the liquid part, and use it in facial rejuvenation through microneedling, where we're doing sort of with these microneedling techniques, pushing this fat just right into the skin and underneath.
Where the crease would be, where the
crease would be, or generally all over. And it has such an amazing effect on the skin. I mean, it rejuvenates the texture of the skin, the surface of the skin. Again, there's a lot of research into how this is working, but there's no question that the future of fat grafting is huge.
Wow. What would be your advice to somebody to never have to see you? To live the healthy life that I would never need the services of a qualified plastic surgeon?
Well, I would say, as a general rule, the majority of what we're talking about is driven by genetics. So you're just born with certain characteristics. I mean, if your mother and father had a thick neck with fat and stuff, chances are you're going to have it as well. But everything being equal, there's certain things you certainly can do. Smoking is probably the biggest factor in the aging process, premature aging. So if you're smoking, you're going to see some changes a lot sooner than others. And just being healthy and using things like sunscreen on your face when you can, and especially for men, which it doesn't come natural to us. But when we're out golfing or something like that, we should have some sunscreen. And certainly when you go to the beach, it's the sunburn probably more than anything that affects the aging process. I mean, time and exposure certainly has an effect on the collagen and orientation of the collagen fibers in our skin, but it's the burning in childhood and early childhood that probably has the most significant effect over time. Well, to some extent, a tan is very protective. I mean, it's the body's protective melanin for the sun, but it's when it's overdone, you get too much of it, and that's why the skin is the major producer of vitamin D's. I mean, you need that sun exposure on your skin for good health, but it's just the overexposure that can be harmful, not only as far as the aging of the skin, but it's also a stimulus in many ways for the formation of skin cancer. So I suppose a healthy lifestyle, not smoking. I don't have opinion as far as good health for alcohol and other things that are available, but I think as a general rule, if you are smart, prudent, and do things in moderation,
we can avoid you.
Yes, if the genetics are there, you can avoid me.
Well, this has been very enlightening. Mary Ann, did you have anything else that you're...
Well, I'd love to know if there's anything on the horizon that would be great for me. Any new injectable that's being researched? I mean, I know fat grafting, a lot is being done in that area. Anything where a month from now, 6 months from now, I'm going to open up the paper and read about something revolutionary that is going to be so exciting.
Well, I'm not aware of anything that's coming up that soon, but I think what was old now becomes new again. It kind of comes around. Microneedling is ancient, but it's being used in such novel ways and when done correctly can create some wonderful results. Couple that with a laser treatment and fat grafting, you get such a nice natural rejuvenation. The lasers, I think they're just kind of reinventing themselves. I don't see a light source is the main thing, and we might hear of a different type of lasers. Something that we haven't talked about, but the robotic hair transplants. is certainly something that for men in particular is going to be a huge future market. And, hair transplants done totally automated and is pretty amazing. For women, again, right now it's the fillers and skincare that the non-surgical options that are still the mainstay of what we've been talking about.
Well, I've learned an awful lot. And we'll make sure that as we do the show notes for this, that we've got your website and everything else so they can learn some more information about Dr. Haven Barlow with Chesapeake Plastic Surgery. Where are you in Northern Virginia?
In the McLean, Tyson's Corner.
Okay. And
Tyson's Corner.
Right here on Bestgate Road in Annapolis, kind of catty corner from the mall, a little bit there. And Mary Ann Treger, who is a sort of a resident expert in authoring the articles and about the different plastic surgery that's been available to both men and women. Interesting how it's all developed and where it's going. And I admire you for keeping up with the.
Well, I would just add, we're blessed to have a number of excellent plastic surgeons in the Annapolis, greater Washington, Baltimore area. And I think, if one of your listeners is contemplating these procedures, if they just go visit with maybe one or two board-certified plastic surgeons, they should come away hearing the same thing, so they can validate what they're being told and be given good, honest advice.
Well, I think with any professional, and it doesn't matter whether it's a lawyer, an accountant, or a doctor, that there's a personal connection that you need to have. I mean, I've got to sit here.
There's no.
You could be the best, receding hairline guy in the world. If I just don't feel comfortable with you, or if I just don't like the way that you have this twitch in your eye or something or other, and I'm just not comfortable for whatever reason, that's probably not a good match for us. And I think I think the patient really has to feel comfortable with the doctor, and the doctor.
Well, it is a relationship because it's an ongoing relationship. And so I appreciate that, and I agree with you.
And, the first bit of advice I give a woman who's contemplating surgery and she asks me, what doctor should I go to? I always say talk to three. To Dr. Barlow's point, not one or two. You really need at least three, and find the one you feel very comfortable with and feel like that person really understands your needs.
And they're probably going to all have slightly different opinions as to what the end result, I would imagine.
Well, years ago, one of my early stories was I went to 4 plastic surgeons in Annapolis, and I asked them each the same question: what would you do to make me look younger? And each one gave me extremely different advice. One was pretty dramatic, I must say, which I didn't think I needed at all. So it should be similar, but it's not always the case.
Well, I certainly understand that. Again, if you're talking to the surgeons and you're asking them about a particular thing that might be for you, I would hope that they would be telling you pretty close to the same thing. Now, one may have a little bit different or a little bit more thing to say about it or this or that, but it should be validating. And then, of course, you choose the physician or surgeon that you feel most comfortable with.
Does your technology allow you to, if I'm looking for a facelift, to give me a projection of what it should look like at the end?
Well, morphing is what you're referring to. That's all dependent upon the software developers. Now, we've got a good software for noses, for example. That same company is developing pretty good applications for eyes and stuff, but for a total face, not very so reliable. Much. And there is a little reluctance from the surgeon's perspective to do something like that, say for a face, because of what the computer might show you and what the surgeon can or physically could possibly do may not necessarily be the same.
And then you've got to couple it in with the expectation of the patient and what we see in the mirror when we're done. Whether it's a little bit off. So that makes all the sense. Well, Dr. Barlow, thank you very much for your time this afternoon. And Mary Ann, certainly thank you very much for connecting us and coming in and joining us.
Thank you.
Letting us learn a little bit about plastic surgery. If you need more information, make sure you check out Dr. Barlow's link for Chesapeake Plastic Surgery on the show notes. And we will see you next time.
Well, thank you very much.
Thank you.
There is a diamond of diamonds, and as you'd expect, it's from the De Beers Group, benefiting from over 130 years of diamond expertise. Only 14 diamond tears in the world are allowed to touch them. Its name? Forevermark. And only one jeweler between Annapolis and Washington has it, Zachary's. Not only is it a beautiful and rare diamond, it's a diamond with a story of responsible sourcing, supporting women and girls in diamond-producing areas around the world through education, healthcare, professional training, and other programs. So when you give a Forevermark diamond, you're not just giving, you're giving back. Zachary's and Forevermark, a jeweler and a jewel. Online at zacharysjewelers.com.
Well, okay. As always, I learned an awful lot. And again, thank you very much to Dr. Barlow and also to Mary Ann Treger. And if you want to learn more or you have an interest in any kind of plastic surgery or different procedures, please check out Dr. Barlow's website. We do have it in a link in the show notes, but you can go to barlowmd.com, and that's BARLOWMD.com. And again, many thanks to Mary Ann for making it all happen. And since this is a holiday week, we couldn't help but notice that your gift must not have made it in the mail. So I'll tell you what, instead of rushing to the post office, standing in line and mailing us gifts or Venmoing us cash or anything like that, we can call it even. Just head to Apple Podcast, search for the Maryland Crabs Podcast, and give us a rating or a review. We would certainly appreciate that, and that really does help us out an awful lot. Helps the podcast to spread. We get listed on Apple Podcast, easily discovered, and everything else. So it's something that doesn't cost a whole lot to do except for a little bit of time, and we would certainly appreciate it if you could do that. Other than that, if you want to get in touch with us, head on over to Twitter at MD Crabs Podcast. You can catch us an email at info@themarylandcrabs.com. Website, of course, is themarylandcrabs.com. Facebook, we've got a page and a group, the Maryland Crabs Podcast. And fairly recently, and we've actually used it a couple times, but we've got a talk and a text back line. And you can call 443-266-3600 and leave a message. We may play it on a future episode. Or if you don't feel like talking, just leave a text message at that. Again, 443-266-3600. This is John Frenay with the Maryland Crabs Podcast. Tim Hamilton is in Altoona, and I understand Tim's got some plans for the episode next week. I'm not sure what they are, so you're going to have to hang out until Thursday, January 3rd. We'll see you next year.
This has been the Maryland Crabs Podcast with Tim Hamilton and John Frenay. Sure to follow them in all the regular places, Facebook, Twitter, YouTube, and online at themarylandcrabs.com. Take a moment to rate us on iTunes. Now, get the hell out of my kitchen. Seriously, go!
You're still here? It's over. Go home.